Hello, everyone. My name is Carl Dargis, and I'm a scientist at Thermo Scientific, and I have experience working heavily with both stem cells and cell therapy workflows. And today, I'd like to take a moment to talk to you about a new instrument that we have called Rotea. And really what it is a very versatile cell therapy workflow instrument specifically made for cell isolation, washing, and concentration. So when we think of cell therapy in general, there are many challenges associated with that whole process being such a new field. One of those major challenges is a scale-up involved with that. So when you think about the process that it takes to bring an idea from the R&D stage all the way through the other stages to commercial production, there's a lot of different considerations that need to be made. And so, one of the big principles around that is the fact that many of the manual laboratory processes that are typically used in an R&D setting are not really suitable for commercial scale manufacturing. And so you can't take a lot of these processes all the way through the stages you see at the bottom of your screen to that point. And so there needs to be other solutions available to researchers trying to do this. And things that will allow them to go from R&D all the way to commercial production without having to make major changes in between that would affect the quality of their products. You can see some images here to give you an idea of what the work being done would be like. So there's just an example of someone working in a hood in the bottom left, and then a larger image of what a production facility might look like. And I'll get into more detail about what the assumptions around that are momentarily. But to touch back on the manual laboratory processes and why these are something that we're really trying to find solutions for and make major changes for. So one thing with regard to the scale-up challenges is that a lot of these manual processes aren't reproducible, and there's a lot of potential reasons for that, whether it might be the fact that certain technicians are performing better or worse, or we never want a situation where someone has kind of magic hands and there's no explanation for why things are doing better or worse than they were previously. So automated solutions are one way to address that. It's also difficult to produce the scale up, and this is kind of the principle of the whole slide, but when you're thinking about just the scale and size that you have to go through from a very small R&D production to commercial, there's so many changes that need to be made, whether it's the equipment itself, oftentimes the number of people working on it, or other considerations. And that's another major contributor to the challenges of scale up. I mentioned staff, but not only the number of staff, but we also have to think about how time consuming the jobs can be when you scale up. It's sometimes a situation where doing twice as much may take 4 times as long because of the logistics of whatever is being produced, which can be really challenging. The cost is another significant contributor. The more space you need, the higher your overhead. All these different things really contribute to cost challenges, which of course for company developing a new product, those things really matter, and that may greatly affect how successful that company can be in producing and getting their product to market and through different regulatory approvals. And again, touching on the staffing challenges, not just from the time-consuming situation, but making sure that you have the right number of people, that everyone's properly trained, resourcing in the right places. All those things make a significant difference. So I mentioned at the beginning that I wanted to just discuss this image on the right where we have a large cell therapy production suite. This is an estimate for an autologous CAR T cell therapy with about a 7-day incubation, producing treatments for about 2,000 patients per year. You can see just how many different separated suites and production spaces need to be happening within the facility in order to make that. And that gets really difficult to secure that much space and be able to pay for it and staff it and do all those things that I mentioned within that facility. And so, as I mentioned, one of the potential solutions to this is automated instrumentation. And that's where the Gibco CTS Rotea system really comes into play. It's designed to be a closed automated cell processing system with a couple benefits that really play into some of the issues with scale up and other things that people may have when they're using manual processes. The first benefit is process flexibility. So although this is an automated system, it allows the users using it to generate specific protocols for their processes. And this is really valuable because every different cell therapy is going to have unique aspects to it that need to be addressed and considered when doing different processing steps. And this system allows you to make those choices for yourself and implement it into your process. The second is low output volumes. This is another unique aspect to this system. Volumes as low as 5 mils of cell concentrate can be used, which is extremely low and allows you to have highly concentrated cells, which is beneficial for a whole host of reasons. The next is high cell recovery and viability, and I'll touch on that in more detail in a later slide. But for now, suffice it to say that the way Rotea works is by generating a gentle fluidized bed that the cells reside in. And that processing technique enables for very high recoveries, upwards of 95% frequently, and virtually no loss in cell viability. The cells that you put in, almost all of them are going to be coming back out when you're done with your processing, and the viability will remain the same. So the system is very gentle with the cells. Finally, this system also allows you to go from research through commercial manufacturing. The single-use consumable kits allow for a completely closed system, and the whole process can be monitored and operated through an OPC UA interface that allows you to go from those early stages through each individual stage all the way through to commercial manufacturing. You know, I touched on the different aspects that make the Rotea system impactful, and one of those is, again, the versatility of the instrument. And so there's a lot of different processes that it's capable of taking part in and operating. And, you know, I'll mention some of those here. Specifically, cell wash and buffer exchange is one of the major applications. Cell concentration, which is related. Elutriation, cell separation, isolation, and selection is all possible as well. The low volume recovery, which I previously mentioned. And then also the range of processing sizes. You know, Rotea is intended for a small to mid-scale processing, all the way from just a few mils up to tens of liters. By the same token, we also have capabilities for performing wash and concentrate on numerous different cell types, whether that be cell lines or stem cells, including HSCs, MSCs, iPSC or ESC aggregates. And as you know, those are very disparate cell types. They're very different from one another. And despite that fact, the flexibility of the system allows you to be able to perform those wash and concentrate protocols on cells that are at the low end of size, just a couple microns, all the way up to those aggregates that are several hundred microns. We also can see there's the capability to do isolations of PBMCs or monocytes directly from a heterogeneous population, such as a leukopak. RBC depletion, again in a similar situation. QC sample prep and isolation, and formulation for cryopreservation. And you can see a quote from a very happy beta tester there, just kind of reiterating my point that, you know, the flexibility is such an important part of the system. And that was from Rebecca Lim at the Hudson Institute of Medical Research, who said it's really, you know, the Rotea is the Swiss Army knife of cell therapy. Now I want to touch on how the counterflow centrifugation, which is the principle that Rotea operates under, works. So this is the system that allows for that fluidized bed to be generated and the cells to be sort of gently collected, concentrated, and outputted. as you can see, there are two different forces that are imparting onto the cells. There's both the fluid force and the centrifugal force, represented with the blue and the red arrow there. And as the cells enter the tip of the cannula and are spread out into the collection cone, these forces are in balance with one another, depending on the settings you use in your system. And as they move towards the back, towards the collection space in the cone, these forces then will become out of balance and push the smaller cells out the back. Once the fluid force becomes greater, those are collected out through the elutriation port. And that's really important because you can then control which cells are captured in the fluidized bed and which are elutriated out. And you have control of that through both the pump rate and fluid rate that is happening within the cone, as well as the centrifuge speed. And so that's a really important principle that Rotea uses, and it, as I mentioned before, it allows you to have cells that are very viable and happy and aren't experiencing any sort of major stressors from this processing, as you would normally have in a traditional centrifuge. So some of the specifications for Rotea, as you can see in the table on the right here, the recommended input volume is anywhere from as low as 5 mils all the way up to about 20 liters, which is a huge range, and as I mentioned before, allows you to go from that small to mid-scale range of processing and manufacturing. The recommended particle size is anywhere from 5 microns all the way up to 300. Again, that allows you to isolate and wash and concentrate things like single cells or aggregates of iPSCs or other cell types. The cell count in the chamber, the minimum amount that is needed to form a bed is about 50 million cells, while the maximum that can be held in the cone is about 5 billion cells. Those estimates are for T cells, and of course they will be slightly different based on the cell type you're working with, but that gives you a good idea of the capability of the input cells. And then finally, the output volume, I mentioned this before, but the output volume is about 5 mils at the low end, and of course has virtually no upper limit. Time is the only limiting factor there. So to discuss further the different aspects of the system, we have the instrument itself, the single-use consumable kit, and the software that allows you to both create protocols as well as operate them on the system. So just want to touch on some of the benefits here, including the fact that the instrument's very compact and able to be moved around the lab quite easily. It doesn't take up very much bench space, which is beneficial. Again, we talked about the difficulties of scale up, and sometimes large instrumentation can cause issues there. Multi-purpose, again, that flexibility is such an important aspect of the system and can be so valuable because it can be used in many different workflows. And then it can be kind of brought in to whatever manual processes might already be happening and adapted to that. Because of the flexibility, you're able to integrate it into whatever system you're already using and allow it to help improve your process. The next is the single-use consumable kit, which you can see is both sterile and closed, which is important and allows for your process to never be exposed to external elements, which greatly reduces the risk for contamination as well as the processing efforts involved. And the input and output ports are both flexible in terms of the way you can design your bag setup on the consumable, as well as the total volumes that are moved around between the different ports. Finally, the software. I mentioned that there's a software that allows you to create protocols, and of course, available to you will be sort of template protocols that you can begin your process from. Say, if you're looking to do a T-cell wash and concentrate, you'd be able to take the base template for that and adapt it to your process quite easily. In addition, the software itself is very easy to use. intuitive and has preset protocols that you can use, as I mentioned. And it also supports GMP manufacturing in that you can have different access user types such that you can use it in R&D for process development and change settings on the fly while running a process, or lock everything down so that nothing can be changed once you have your process set. To give you an idea of what the system looks like while running, here's a larger image of that. You can see here the cells forming that stable bed at the tip of the cone in the foggy white area towards the tip. In addition to the high quality camera that allows you to visualize your cells while they're being processed, you also have the steps that are being run, and the software follows along during that process, in addition to the settings that are currently in use, the pump speed, the centrifuge speed, the step time remaining, and the total time remaining. This really is another huge benefit. Many other systems out there are more of a black box where you put your cells in and it gives you something out and you don't know how the process went until after it's done. Being able to visualize your cells during this process really gives you a big advantage, especially during that early stage of development in more of an R&D setting, because you can make those changes as it's happening and identify how those changes to your settings are affecting your cell viability, your cell output, the size of the bed that's being collected, and all those other factors. To touch on some data, I want to focus on one of the core competencies that Rotea has, which is T-cell wash and concentrate, and really look at the high recovery and viability and low output volumes that are capable of achieving with Rotea. So on the left here, we have an example of 5 billion T cells being washed and concentrated with the Rotea system over the course of 2 different runs. And you can see here that not only is the viability extremely high, well over 90%, and same for the recovery, the runs are consistent in that we see this phenomenon consistently, that both viability and recovery are very high, even when maxing out the cone capacity at 5 billion cells. In the center panel, we have low output volumes, both 5, 10, and 20 mils, all being used here when processing 500 million cells. And again, the same is true as with the large scale cone capability. You can see that the viability and recovery is very high, well over that 90% threshold for both. So the cells are not only being recovered very consistently, they're also very happy and not experiencing any kind of cell death. In addition, processing using Rotea doesn't cause any change in the constituent cell types. So we looked at CD4 and CD8 populations within cells that underwent T-cell wash and concentrate, and saw that there were almost no difference between the cells before Rotea processing and after. So there's no kind of selections going on for T-cell subtypes, which is something you always want to make sure, especially within the context of cell therapy. You want to make sure that your constituent cells are remaining consistent throughout any processing steps so that the final product is consistent. Looking at a PBMC isolation using Rotea, you can see on the left the difference between the cell types within the leukopak and then a processed leukopak, what comes from the output of the Rotea. And the first major change here is the RBC depletion that we see. So this was performed with ACK lysis buffer, and you can see that the RBC population drops from well over 50% of the total cells to less than 5. You can see that with the T cells, the opposite is true, that there are fewer T cells as part of the total population in the initial leukopak, but once those RBCs are depleted, a high percentage of the T cells make up the entire cell population. And generally that is true with the rest of the cell types as well. After this processing, we took cells, these T cells, and put them through an expansion process. And so this was actually done using Rotea, and side by side we did the exact same experimentation using a density gradient. And as you can see, those lines in the upper right graph are basically right on top of each other in that the expansions were identical. And so when comparing Rotea to a manual process such as density gradient isolation, the outputs are really consistent, and we don't see any significant change. But of course, the benefit with Rotea is that the time is greatly decreased, and you have a closed system being maintained throughout the whole process. On the bottom right, we have staining for a few different markers, again, to show that there's no major changes that are happening due to Rotea processing. And those are very consistent with what we see for density gradient processing. We looked at CD4 helper T cells, CD8 cytotoxic T cells, as well as a few other markers, including CD62L and CCR7, identifying those cytotoxic T cells that are most likely to perform killing of cancer cells within cell therapies, and the LAG3 and PD1, which are both exhaustion markers, and these were consistent across both methods. So as I kind of wrap up, I just want to take a moment to touch on what some of our early adopters and beta testers have said about the system. And specifically, we have a quote here: "Rotea is exactly what the cell therapy sector has been waiting for, a flexible, single-use system that is aggressive on efficiency but gentle on cells." In general, early adopter feedback has been very positive, and some of the aspects that I'll touch on here include the fact that there's impressive ability to process fragile cells, specifically primary cells and iPSC aggregate, as well as high recovery and concentration compared to competing technologies. And finally, that flexibility, which I've mentioned multiple times in utility, that are able to motivate customers to incorporate into many different processes that they might be working on, or even within different groups within the same company. Thank you very much for listening to my talk about Rotea today, and thank you.